Hi. So today I will be talking about something that might make me cry a little bit, but that's okay. Um, it's about the staff training requirements in these mental health units that where the providers are not just trauma informed and know how to deal with trauma, but not this disability trained and informed, but specifically trauma, disability trauma informed and trained, because a lot of people with disabilities have trauma because due to the disabilities that they have. Um, so an example would be me with my epilepsy, and all that, like medical PTSD I have because of things that were done to me in the medical side of things where I wasn't informed um, of the risks and benefits of procedures or medication, what side effects of medications could be into after something happened. Um, which obviously that causes in itself something called medical PTSD. And just a bunch of that pile like over time can really affect someone mentally, and they won't be the same as they were before all that happened. Um, One of the things that really got to me was, um, sorry, um, this is very hard. My cardiologist office wanted me to do a nuclear stress test. And when I was going into that appointment for the nuclear stress test, that morning of the appointment, as I was walking in, something inside me felt off, but I didn't understand why I was feeling that way. Um, and then all of a sudden, next thing I know, I'm in the hospital's ER because I had a seizure during the um, procedure. And before I went into the follow-up appointment, um, regarding what happened, I did research, and it turns out that they shouldn't have done it on me because they knew before wanting to do that procedure that I have a history of seizures. So nuclear stress tests are not supposed to be done. People with a history of seizures, and one was they were trying to do one on me, even though they knew. But they didn't tell me that that was a possibility. They just went ahead and ordered the test, and I was like, okay, let's do it because I didn't know. Um, and it's every time I wake up in an ER because of a seizure, it is so disorienting, so traumatic because I don't remember having the seizure. I don't remember what happened. I just remember bits and pieces. Um, like what led up to the seizure and what happened at then waking up in the ER. And then other times means that hearing paramedics saying that it's not a seizure, like stuff like that, or being like being tricked into saying that I was faking seizures when I wasn't. Like the neurologist wanted during a summer camp that I went to when I was 17 for people with epilepsy, by teachers at school, and the teachers only blamed me because the paramedics said it wasn't really a seizure. Yeah. So instead of listening to me, the student that has epilepsy, they listen to paramedics who got there after I had the seizure, like after, like, or I'm assuming they call it the paramedics. I'm not quite sure, but I know that my parents were there. So just little things like that, and then putting on the medical side, putting stuff on the chart, stuff like likely PNES, meaning psychogenic non-epileptic seizures, when they know I have epilepsy. Yes, there are people that have both, but yet at the same time, mine are focal seizures, and most, like, they can't really, those don't really show up on EEGs because they're so deep in the brain. So if you know the type of seizures a patient has, and you still say it's something else, that, like, that adds trauma. That adds to the mental health about, like, I'm not good, I'm not meant, like, nobody really cares about me, kind of things. So you have to really look, like, go to the person with disabilities and talk to them and ask what really brought them there, like, and go maybe a little deeper with them than you would somebody else without disabilities, because they don't always feel like putting up because of the trauma. But if you had somebody that was trauma informed and disability informed slash trained, and trained in the specific kinds of traumas that can come with having a disability, a medical condition, such as epilepsy, it would help them a lot on the unit. And if you talk to their providers after finding out, their outside providers after finding out that, well, what they said about what really brought them there, maybe to let them know, don't do this kind of thing. Like, try not to do this to this to this patient, because it really affects their mental health, and they're currently in a mental health unit because of it. But it could be other traumas also, but there's a lot that's like trauma and then disability, and then on top of the disability that came from the trauma, there's trauma that's caused by having a disability itself. So they could have two different kinds of trauma and two different kinds of PTSD. They could have real PTSD because of the trauma before a disability happened, or they could have just regular, like, medical PTSD because of how they're treated in the medical system, um, system, mental health system, because we really need more therapists, even outside of mental health units, that understand people with disabilities and like that are trained in helping those with disabilities and dealing with the trauma that comes along with having a disability and the trauma that caused the disability, like to go at it from both angles, not just mental health. You're here for your mental health, so let's just focus on that. And like outside providers should also focus on the same stuff and mental health combined with the medical, or the medical combined with the mental health, and just talk to each other about the patient and about what might be best for them. Um, because it's really hard for someone to constantly tell their story to multiple providers, and especially when they have to switch providers because they have different insurance, or they live somewhere different than they used to, or they're an adult now and not a child. It just all adds to the mental health um, of somebody with disabilities. That is all for tonight. I will see you again tomorrow. Thanks. Bye.